back. This morning we're speaking with Dr. Ben Emery from Aspen Ridge Dental. Thanks for coming in.
Thank you for having me.
All right, we're talking about a problem that keeps far too many people awake at night, snoring, sleep apnea.
That's right.
So I have a problem with that word, but tell us a little bit about sleep apnea. What is it?
So sleep apnea is characterized by periodic pauses in breathing during the night. And usually the person who is suffering from this, they don't realize that it's happening. It's usually the person, the spouse or the person that's sleeping with them that can recognize the episodes of, you know, where the person is not breathing and all of a sudden gasps for air. And these periods of non-breathing can go anywhere between 10 seconds and 40 seconds in length. Wow. So the person will actually stop breathing entirely and then gasp for air, wake themselves up, etc.
Okay. What kind of problems does that cause for them?
So usually the most common problem is daily fatigue and sleepiness the next day, because what's actually going on is that that person is in their REM sleep cycle, and when they gasp for air, they wake themselves up, and so they disrupt that sleep cycle, which is critical for mental recovery and physical recovery. So the next day they're exhausted.
Also known as morning show itis, which
That's
we have
right.
here. So you brought us some pictures that we can take a look at as well. Tell us what's happening here.
On the left-hand side, this is a normal person sleeping, laying down, and you can see that the airway is actually not occluded, so the tongue is away from the back of the throat, so air is actually flowing through. In a person who's suffering from sleep apnea, the tongue actually falls in the back of the throat, impinging in this area here, so that not enough air is getting down into the lungs. And so this is what we see as far as a person who's suffering from sleep apnea, because when you're sleeping, your muscles are very relaxed, and things tend to fall back due to gravity.
So people that are concerned that they might have sleep apnea, you were saying that they can do sleep studies to find out whether how much of a problem it could be.
Talk to your doctor, have a sleep study performed. It can measure your O2 saturation during the night, etc. So one way to combat that is actually a CPAP machine. It's a machine that you wear a mask. There's an air pump. It pumps air into your mouth and your lungs during the night so that you don't gasp. The first picture, this one right here, is actually a device. It is a splint, or it looks like a mouth guard basically that you wear for sports. It goes on the top teeth and the bottom teeth, and what this does is actually hold your jaw in a downward and forward position, so it pulls your tongue away from the back of your throat. So when you're sleeping in the supine position, it holds it away so you can actually breathe better. A newer device is this. It's called an Avio, and what this is made out of is silicone.
It does look like a pacifier.
It looks like a pacifier. It's an adult pacifier. And the intent of the purpose of this is actually you pinch the bulb at the end, you insert your tongue inside this area here, and so it creates suction on your tongue, pulls your tongue out, and then these wings on the top and the bottom actually prevent your tongue from going back inside your mouth. So it holds your tongue out from your mouth, so to prevent snoring and sleep apnea.
Definitely more advanced devices than simply hitting your spouse with a pillow. So I'm glad to see that there's some options. Thanks for coming in and explaining all this to us.
Thank you.
If you have any questions, you can call the folks at Aspen Ridge Dental. Coming up next, meteorologist Joe Hansel will have another check of your weather forecast, and if you're just joining